They say growing older is a privilege not everyone gets, but with the passing years come new challenges, some visible, some quietly lurking beneath the surface. If you're a man over 60, or even approaching that milestone, you've likely heard about the prostate, that walnut-sized gland tucked away beneath your bladder. Maybe your doctor mentioned it during your last checkup, or perhaps you've seen commercials promising relief from frequent bathroom trips. But here's the truth most men never hear. An enlarged prostate, or benign prostatic hyperplasia, doesn't always announce its arrival with blaring sirens. Its earliest symptoms are subtle, sneaky, and all too easy to brush off as just getting older. Today, we're diving deep into the 12 early symptoms of an enlarged prostate most men miss. Because catching these signs early isn't just about comfort, it's about protecting your health, your confidence, and your independence. Let's start with something familiar. Picture those quiet moments late at night, when the house is still and you're just drifting off, only to be jolted awake by the urge to pee. You shuffle off to the bathroom, maybe grumbling about your age. But what if those nighttime trips are more than just a nuisance? Frequent urination, especially at night, is one of the most overlooked signs of an enlarging prostate. You might find yourself waking up once, twice, maybe even 3 or 4 times, disrupting your sleep and leaving you tired the next day. This isn't just about inconvenience. Poor sleep can lead to memory problems, mood swings, and leave you feeling less like yourself. But here's the catch. Most men chalk it up to aging, never suspecting that their prostate is quietly making its presence known. But the story doesn't end there. Think about those moments during the day when you suddenly feel the urgent need to rush to the restroom. The urge comes on strong sometimes, out of nowhere, and you wonder if you'll make it in time. This sudden, compelling need to urinate, known as urinary urgency, is another early sign of an enlarged prostate. It's easy to dismiss. It happens to everyone sometimes, right? But when urgency becomes a regular part of your life, interrupting meetings, dinners, or even time with your grandchildren, it's worth paying attention. The prostate sits just below the bladder, and as it grows, it can press against the urinary tract, making the bladder more sensitive and reactive. The result? You're always on high alert, planning your day around restroom availability, even if you'd rather not admit it. Now, let's talk about something a little more awkward. Have you ever noticed your urine stream isn't as strong as it used to be? Maybe it starts and stops, or feels weak and hesitant, like a trickle instead of a flow. This is called a weak or interrupted urine stream. For many men, this is one of the first changes they notice, but it's often shrugged off as just part of getting older. But it's actually your body sending a message. The prostate is growing, and it's making it harder for urine to pass through. You may not want to mention it to anyone, but if you find yourself standing longer at the toilet, waiting for things to finish, take note. It's a sign worth remembering. Sometimes, even when you think you're done, you're not. That feeling of incomplete emptying, when you finish urinating but still feel like you need to go again, is another early, easily missed symptom. It's frustrating, isn't it? You go through the motions, but you're never quite sure you're finished. This sense of residual urine is more than just a hassle. It can lead to bladder infections, stones, and more serious health issues if left unchecked. And yet, most men keep it to themselves, assuming it's nothing to worry about. Let's pause for a moment and reflect. These symptoms aren't just physical, they come with a mental and emotional toll. You might feel embarrassed, frustrated, or even anxious about your body's changes. You might avoid social events, long car rides, or outdoor activities, just in case you need a restroom. The truth is, you're not alone. Millions of men experience these symptoms, but few talk about them openly. And that silence can lead to isolation, anxiety, and a loss of confidence. But it doesn't have to be that way. Back to the symptoms. Have you ever noticed dribbling after you finish urinating? You zip up, walk away, and then, there it is, a few unexpected drops. Post-void dribbling might seem minor, but it's another sign your prostate is changing. It can lead to discomfort, embarrassment, and even skin irritation if it happens frequently. You might start carrying tissues, changing your underwear more often, or feeling self-conscious in public. While
tempting to ignore, it's worth paying attention to these small changes. They're your body's way of asking for help. Another sign that often slips under the radar is difficulty starting urination. You stand at the toilet, ready to go, but nothing happens. You wait, you strain, maybe shifting your stance or trying different tricks. That hesitation isn't just annoying, it's a classic sign of an enlarged prostate. As the gland grows, it narrows the urethra, making it harder for urine to start flowing. You might not mention it to your doctor, but it's a symptom that deserves your attention. And sometimes, it's not just slow to start, it stops altogether. Intermittent flow, where your stream starts and stops several times during urination, is another early warning sign. You might think it's a fluke, but if it happens regularly, it's time to take notice. This symptom can disrupt your routine, make you feel impatient, and even lead to accidents if you're in a hurry. Let's talk about pain. Most men don't associate prostate problems with discomfort, but a growing prostate can sometimes cause pain or burning during urination. It might be a mild sting or a persistent ache, easily written off as a minor infection or dehydration. But if you notice pain during urination, especially if it's new or worsening, it's important not to ignore it. Pain can signal inflammation, infection, or other complications that need medical attention. Blood in the urine is another symptom that demands your attention. Even a small amount, just a pinkish tinge or a few drops, can be a sign of prostate changes. Blood in the urine is never normal, and while it might be caused by an enlarged prostate, it can also indicate more serious conditions like bladder or kidney issues. If you ever notice blood, don't wait, see your doctor right away. Difficulty controlling urination or incontinence is a symptom that can deeply affect your quality of life. You might leak a little when you laugh, cough, or sneeze, or find it hard to hold urine until you reach the bathroom. Incontinence is often misunderstood as a normal part of aging, but it's frequently linked to prostate enlargement. It can lead to embarrassment, social withdrawal, and a constant sense of worry about accidents. Another subtle sign is a change in the color or smell of your urine. The prostate can affect the bladder's ability to fully empty, leading to stagnant urine that develops a stronger odor or darker color. You might notice your urine smells more pungent or looks cloudy, especially if you're not drinking more water than usual. These changes can indicate infection or inflammation, a signal to pay closer attention. Last but not least, sexual difficulties can be an early sign of prostate enlargement. The prostate is involved in sexual function, and as it grows, it can contribute to problems like erectile dysfunction, reduced libido, or pain during ejaculation. These changes are often hard to talk about, but they're important clues that your prostate health is changing. Sexual health is a vital part of well-being, and ignoring these symptoms can affect your relationships, self-esteem, and overall happiness. Now, if you're listening and thinking, I've noticed some of these, but they don't seem serious, you're not alone. Most men miss the early signs because they're subtle, gradual, and easy to attribute to aging, stress, or lifestyle. But catching them early can make all the difference. An enlarged prostate isn't just about more bathroom trips. It can lead to urinary retention, infections, bladder damage, and even kidney problems if left unchecked. The good news is there are effective treatments, lifestyle changes, and preventive steps you can take if you know what to look for. So, what should you do if you recognize one or more of these symptoms? First, don't panic. An enlarged prostate is common, especially as you get older, and it's not the same as prostate cancer. But it does deserve your attention. Start by tracking your symptoms, when they occur, how often, and how severe they are. Bring this information to your doctor, even if it feels uncomfortable. Early intervention can mean simpler treatments, fewer complications, and a better quality of life. There are also steps you can take at home. Staying active, maintaining a healthy weight, and limiting caffeine and alcohol can help reduce symptoms. Pelvic floor exercises, like Kegels, can strengthen muscles and improve bladder control. Drinking plenty of water, without overdoing it, keeps your urinary system healthy. And don't forget the importance of regular checkups. Even if you feel fine, annual visits can catch problems early and keep you on track. But beyond medical advice, there's a deeper message here. Aging doesn't have to mean losing control over your body or your life. With knowledge, courage, and support, You can face these changes head-on. Talk to your friends, your partner, or support groups. Share your experiences, ask questions, and listen to others. The more we speak openly about prostate health, the less stigma and embarrassment we all have to carry. If this message resonates with you, take action today. If you've experienced any of these 12 symptoms: frequent urination at night, urinary urgency, weak stream, incomplete emptying, post-void dribbling, difficulty starting, intermittent flow, pain or burning, blood in urine, incontinence, changes in urine color or smell, or sexual difficulties, don't ignore them. Write them down, talk to your doctor, and start making small changes to support your health. Remember, your prostate is small, but its impact on your life can be huge. Early detection is the key to staying independent, active, and confident as you age. You deserve to feel your best, to enjoy time with family and friends, and to live life on your terms. So, let's recap. The 12 early symptoms most men miss are: 1. Frequent urination at night. 2. Urinary urgency. 3. Weak or interrupted stream. 4. Feeling of incomplete emptying. 5. Post-void dribbling. 6. Difficulties starting urination. 7. Intermittent flow. 8. Pain or burning during urination. 9. Blood in urine. 10. Incontinence. 11. Changes in urine color or smell. 12. Sexual difficulties. These signs might seem small, but together they paint a clear picture of your prostate health. Don't wait until symptoms get worse. Take action, talk openly, and prioritize your well-being. You're not just taking care of your body, you're protecting your independence, your confidence, and your future. If you found this information helpful, subscribe for more content on men's health and aging. Well, share your experiences in the comments. What symptoms have you noticed, and how have you handled them? Your story could help another man who's struggling in silence. And if you know someone who could benefit from this message, share it with them today. Together, we can break the silence, support each other, and face the challenges of aging with strength and dignity. Thank you for listening, and remember, your health matters. Don't let small symptoms hold you back. Pay attention, take action, and keep living your life to the fullest. Subscribe, comment, and share, and let's build a community of men looking out for one another. You're not alone, and with the right information and support, you're stronger than you think.